Have you ever walked into a room to get something, and then when you get there, you ask yourself, what was I going to get? Has that ever happened to you? Some people refer to this as having a senior moment. And it happens to many people each and every day. Madam Toastmaster, fellow Toastmaster and guest, I want to talk to you about people that live with the disease each and every day, known as dementia. Worldwide, there's an estimated 24 million people that live with this disease. It is one of the world's fastest growing diseases, and it is second only to cancer. It is fast becoming everyone's problem, and it's not going away. The first time my mom told me that my stepdad, Len, was going crazy or losing his mind, I didn't believe it. I said, he's just messing with you, Mom. He's joking around. He knows what he's doing. And she said, Johnny, he's not acting. You should see the way he behaves at night, and the way he acts, and the way he treats me. He's throwing stuff, breaking it. He's cussing me out all the time, and I just can't deal with him anymore. And as far back as I can remember, from the time I was a little kid, my mom and stepdad had always had, little difficulties and disagreements. So to me, I saw it as nothing. I didn't see it any different than what I had seen growing up. Dementia is a disease that affects the elderly. It usually affects those that are 65 years of age and older. It affects their mental ability, and it prevents them from gaining any more knowledge, and their mind begins to deteriorate faster than the normal senior citizen. If it occurs before the age of 65, it is known as something as, it's referred to as early onset dementia. It is a progressive disease that starts out slowly and gradually progresses. And for you to be diagnosed with dementia, you usually have to have these symptoms for about 6 months before a doctor can diagnose you with that. My stepdad, Len, had a serious work accident back in 1998, which caused him to severely mangle his left leg, which doctors couldn't repair and get circulation back into. So eventually they had to cut his leg off. But for 13 years, he was able to get around using a walker and a wheelchair. And considering the situation, he was still pretty independent. Any given day, you could find him at the local hospital, greeting patients, talking to people he didn't even know. Very friendly guy. You could find him at Walmart, just strolling the halls, or actually cruising the halls. Or you could find him at the local Taqueria Jalisco eating breakfast. But his life changed back in July 24, 2011. When as he was walking, he lost his balance, fell to the ground, and broke his foot. While hospitalized, he was eventually diagnosed by the doctors as having dementia. Now, my mom had to care for her husband, who was immobile and dealing with dementia while still recovering herself from open heart surgery. See, dementia affects a person's memory, attention, ability to communicate, and their problem-solving abilities. People with dementia have problems doing simple things such as keeping track of their wallet, paying their bills, getting in and out of their own neighborhood, making appointments, keeping appointments, things of that sort. They also display uncharacteristic behaviors such as mood swings, and they often have brief periods of anger and rage. As the disease progresses, they become unable to carry out daily activities such as bathing, putting on their own clothes, grooming, and even using the toilet. Some suffer from hallucinations, while others experience something called sundowners. This happens when there is a disruption in their sleeping pattern. The mind's playing all kinds of tricks on them, and they get their days and nights confused. And they'll be napping all day and stay up all night. During the fall of 2011, Len was in and out of nursing homes, receiving care for his broken foot. Eventually went home, and my mother was left with the task of taking care of him. She had to feed him, change him and put up with his constant mood swings. His anger and behavior was more than my mom could handle. Many times she would come over to my house to talk to my wife, and she would break down crying, and she'd just say, "I can't put up with him anymore." I just couldn't understand what she was dealing with at the time. As most dementia patients, Led too suffers from sundowners. He would sleep during the day and stay up all night. And as his caretaker, this disease would begin to take a toll on my mother. Every time I saw her, she would tell me how tired she was. I just took it as a symptom of her heart surgery. On Friday, March the 9th, 2012, I received a call from my older brother. You know, one of those unexpected calls that you get during the middle of the day, and it catch me by surprise. He said, "Johnny, Mom's dead." I said, "No way. What happened?" He said, "Lilito found her lying on the floor, and she's already hard." As my stepdad's caretaker, she had the sole responsibility of taking care of him. The sleepless nights and constant attention that he needed was too much for her weak heart. Upon my mother's death, my brothers and I found ourselves assuming her role as primary caretaker. We quickly found out how difficult it was to take care of him. To the first night I remember spending the night at my mom's house to take care of him, I can tell you that I never slept more than 15 minutes at a time without some kind of interruption. It was an exhausting night. We quickly discovered what my mother had been dealing with all those months. We realized that it was more work than one person could handle. See, dementia is not a disease that just affects the individual. It also affects the people that are caring for them. See, there are two risk factors associated with this dementia: genetics and aging, which we have no control over. And without a major medical breakthrough in sight, the number of individuals suffering from dementia could jump to 84 million by the year 2040. If you or a loved one has experienced memory loss or other changes in thinking skills, don't ignore them. See a doctor soon to determine the cause. Only a professional evaluation can determine whether it's a treatable condition. And if any symptoms suggest dementia, an early diagnosis may allow you or your loved one to benefit from any available treatments to avoid the hurt that this disease may cause. Thank you.